Hello and welcome to this video about chemotherapy and its impact on cancer treatment. It's a difficult topic to talk about, but we believe it's important to address. Chemotherapy is a commonly used treatment for cancer patients, but it's also known for its harsh side effects. Despite this, some doctors and researchers question its effectiveness, like Dr. Peter Glidden, who claims that chemotherapy only works 3% of the time. So, in this video, we want to explore the controversy surrounding chemotherapy and its low success rate. We'll also look into alternative treatments for cancer and share a success story with immunotherapy. Most importantly, we want to emphasize the importance of patient-centered care and how it can make a difference in cancer treatment. We hope that by sharing this information, we can help those who are going through cancer treatment or supporting someone who is. Let's get started. Chemotherapy, the go-to treatment for cancer patients for decades. But did you know that despite its widespread use, chemotherapy only works 2.3% of the time in Australia and 2.1% of the time in the USA? That's right, over 97% of the time, chemotherapy fails to cure cancer, and worse yet, it can be harmful. So why are we still waging a war on cancer with a treatment that fails so miserably? Let's find out. So, why is chemotherapy still being used as a primary treatment for cancer patients? The answer is simple: profits. The pharmaceutical industry generates billions of dollars each year from cancer treatment drugs, including chemotherapy. It's not in their best interest to acknowledge the inefficacy of chemotherapy, nor to explore alternative treatments that may be more effective. But chemotherapy is not only ineffective, it's also dangerous. Some drug treatments promote the spread of cancer. This fact is often ignored in discussions about chemotherapy's effectiveness. The principle of medicine is primum non nocere, which means first not harm. However, conventional cancer treatments can in no way, shape, or form be considered harmless. Chemotherapy is a toxic treatment that can cause debilitating side effects such as nausea, hair loss, fatigue, and an increased risk of infection. Why is Dr. Glidden saying that chemotherapy does not work 97% of the time? Dr. Peter Glidden argues that chemotherapy does not work 97% of the time based on a study published in the Journal of Clinical Oncology in 2004. The study looked at the success rates of chemotherapy in terms of how many cancer patients were still alive after 5 years. The study found that the overall contribution of curative and adjuvant cytotoxic chemotherapy to 5-year survival in adults was estimated to be 2.3% in Australia and 2.1% in the USA. This means that for the majority of cancer patients, chemotherapy only provides a minor contribution to their survival. In fact, for stage 4 cancers, the success rate is less than half of 1%. Dr. Glidden argues that these statistics show that chemotherapy is not an effective cancer treatment and that it should not be used as the primary treatment option. Dr. Glidden further argues that the reason chemotherapy is still being used as a primary treatment option is due to the financial incentives for the pharmaceutical industry, as well as the lack of funding for alternative treatments. He believes that patients should be given more information about alternative treatments such as immunotherapy, targeted therapy, and photodynamic therapy, and be encouraged to make informed decisions about their treatment options. Why chemotherapy is still being used despite its low success rate? Chemotherapy is still widely used as a primary treatment for cancer patients, despite its low success rate, for a few reasons. One of the biggest factors is the influence of the pharmaceutical industry, which has a financial stake in promoting chemotherapy drugs. The industry invests heavily in research and development, patenting and marketing these drugs, and profits from their sale. This creates a powerful incentive to push chemotherapy as the best option for cancer patients, even when the evidence suggests otherwise. Another factor is the lack of funding for alternative treatments, such as immunotherapy, targeted therapy, and photodynamic therapy, which has shown promising results in some cases. These treatments may be less profitable for the pharmaceutical industry, and as a result, they receive less research funding and are often not covered by insurance. This makes them less accessible to patients who may want to explore other options besides chemotherapy. But there's another side to the story as well. While chemotherapy may have a low success rate, it can still be effective in some cases, particularly when used in combination with other treatments. It's also often the only option available for patients with advanced or aggressive forms of cancer. So while there may be valid criticisms of chemotherapy, it's important to recognize that it's still an important tool in the fight against cancer. Alternative treatments for cancer are becoming increasingly popular as people seek out options beyond traditional chemotherapy and radiation. Immunotherapy. Immunotherapy is a type of cancer treatment that uses the body's immune system to fight cancer cells. This type of treatment is often used in combination with other treatments, such as chemotherapy or radiation, and can be used to treat a variety of different types of cancer. One type of immunotherapy, called checkpoint inhibitors, works by blocking proteins that cancer cells use to hide from the immune system. Another type, called CAR T-cell therapy, involves modifying a patient's immune cells to target and kill cancer cells. While immunotherapy can be highly effective for some patients, it can also come with significant side effects, such as inflammation and damage to healthy tissue. One success story with immunotherapy is the case of former President Jimmy Carter, who was diagnosed with melanoma that had spread to his brain. After undergoing treatment with an immunotherapy drug called pembrolizumab, his cancer went into remission. It's important to note that while alternative treatments like immunotherapy, targeted therapy, and PDT can be highly effective for some patients, they may not be appropriate or effective for all types of cancer or all patients. It's always important to work with your healthcare provider to develop a comprehensive plan for cancer treatment. In addition to discussing the limitations of conventional cancer treatments, it's important to highlight the importance of patient-centered care. Patients are unique individuals with their own set of needs, preferences, and circumstances. Therefore, a one-size-fits-all approach to cancer treatment is often inadequate. Patient-centered care involves an approach that is tailored to the individual needs of the patient. This includes taking into account the patient's medical history, personal preferences, and other factors that may influence treatment decisions. Effective communication between patients and healthcare providers is critical to ensuring patient-centered care. Patients should feel comfortable asking questions and expressing their concerns to their healthcare providers, and healthcare providers should provide clear and accurate information to help patients make informed decisions about their treatment. It's also important for patients to be empowered to take an active role in their care. This means that they should have access to information about their treatment options and be encouraged to participate in the decision-making process. Patient-centered care has been shown to improve patient outcomes, including quality of life, satisfaction with care, and even survival rates. By prioritizing the needs and preferences of individual patients, healthcare providers can provide more effective and compassionate care that truly meets the needs of the patient. Side effects of chemotherapy. Overview of the physical and psychological effects of chemotherapy on patients. Here are some of the physical and psychological effects of chemotherapy. Nausea and vomiting, hair loss, fatigue, increased risk of infection, cognitive effects, emotional effects. Side effects of chemotherapy can vary depending on the type of cancer, the drugs used, and the individual patient's health and medical history. Some patients may experience few or no side effects, while others may have more severe or long-lasting side effects. Patients need to talk to their healthcare providers about any side effects they experience during chemotherapy. Healthcare providers can help manage side effects with medication, lifestyle changes, and other interventions. While chemotherapy remains a common treatment for cancer, its low success rates and debilitating side effects cannot be ignored. It is important for patients to be aware of alternative treatments and to work with their healthcare providers to make informed decisions about their treatment options. At the end of the day, patients must receive personalized care that takes into account their individual needs and preferences. Patients should be empowered to make decisions about their treatment and have open communication with their healthcare providers. We hope that this video has provided valuable insights into the pros and cons of chemotherapy, as well as alternative treatments and cancer prevention methods. For further information on cancer treatment, prevention, and support, we encourage viewers to visit reputable sources such as the American Cancer Society, the National Cancer Institute, and Cancer Research UK. Thank you for watching and taking the time to learn more about this important topic.